somamos esforços, aproximamos talentos e empresas. Juntamos quem é diferente, unimos fronteiras, colecionamos conquistas. Somamos conhecimento, unimos a tradição e o novo. Juntos, misturados, conectados. O que nos junta vai além do espaço físico da sala de aula. O que nos une é o espírito alvarista de trabalho em equipe, cooperação e inovação. Estar junto é ter alguém com quem contar. Estar junto é ter alguém para nos incentivar. Junte-se a nós. Juntos, iremos cada vez mais longe. Na FECAP, a gente realiza juntos. FECAP. 118 anos juntando tradição e juventude.
Well, hello everyone. I'm Carolina Pavese, and it's a pleasure to be here with you all today discussing this very important topic. And I know we have people from all over the world, so this is one of the few advantages that this pandemic has brought us. And it's very nice to be here sharing this screen with my friend Catiuxa Galheda, who's going to be joining me in this discussion on the gender impact of COVID, the gender dimensions of COVID-19. And I would like to start by introducing her. So Dr. Galheda, she holds a PhD in political science from Unicamp in Brazil, and she's now a visiting member of faculty at the sociology department at the University of Grande Dourados. So Catiuxa, welcome and hi.
Hi, Carol. Well, thanks for the invitation, and it's a pleasure to be here talking with you a bit about gender issues at the coronavirus context. So I'm going to introduce Carolina too. Carolina Pavese holds a PhD in international relations from the London School of Economics and is currently assistant professor in international relations at ESPM in São Paulo. Dr. Pavese is also part of the Jean Monnet program at FECAP, where she coordinates a group on women and girls with 25 young scholars from all over Brazil. Well, I think Carol is going to introduce this talk, and then I'm going to talk a bit about Brazilian issues, right?
Yes, exactly. Thank you for the introduction. And we would like to start by saying and explaining the name we gave to, the title we gave to this presentation. So shadow pandemic has been a name opted by the United Nations and the World Health Organization. They have been calling the side effects or the consequences on the increase of domestic violence as the shadow pandemic. So it's a perspective and is one of the facts we have been witnessing of this pandemic on the gender dimension and on women worldwide, and this has been a cause of concern for all politicians and civil society in general. But we would like to take a step further and then apply this concept of shadow pandemic, so this term, to a more multidimensional perspective on the gender impacts of COVID-19, and invite you to think about this in terms of economic impact, health consequences, and this long-term dramatic effect that the pandemic is due to have in exacerbating and increasing gender inequality. So these are some of the few topics we're going to address here. We're going to just a little bit of houseworking before we start entering this discussion. We're going to have Dr. Galheda. She's going to start with her presentation on Brazil. So she's going to bring us some data and some food for thought on the Brazilian perspective of the pandemic and the impact on Brazilian women. And then I'll be addressing the European side. And in the end, we expect to have a very fruitful discussion with you. So please feel free to type in your questions and your comments. And if you want to say hello and say where are you from, we would like to hear, also to know who are we talking with. It would be very nice. But along the conversation, just join us and type in your questions. We're going to take the questions and comments after our two presentations, and that's probably going to be the most exciting part of this talk and this webinar. So without further ado, Katusha, please, you can share your screen and the floor is yours.
Thanks, Professor Pavesi. Well, here we go. So the shadow pandemic, it has all to do with things I'm gonna explain in this presentation. I'm gonna talk specifically about the Brazilian context during the coronavirus context. I'm gonna try to talk all I want to in like 15 or 20 minutes. Let's see if I am successful on that. So the presentation is always in dialogue with Professor Pavesi, and we're going to talk about our context here in Brazil, and then she's going to talk about different European realities, and then I'm going to try to do this kind of comparison with different European realities, although the European realities are different amongst themselves. So first, I'm going to talk about sex and gender-based violence, and then about gender, labor, and employment relations. Finally, I'm going to talk about the specific reality of Indigenous women here, where I live, the Mato Grosso do Sul state. And it's worth mentioning this issue I'm going to do of talking about structural issues and then talk about those topics in the pandemic context. This is important because there are some previous issues that were not so good in Brazil before coronavirus. So it's worth contextualizing first what were those issues, and then talking about the virus context itself. And then finally, I'm going to talk a little about state responses in the country. So first, talking about femicide, before the pandemic, the framework of femicide in Brazil were not so good, right? So femicide is a specific homicide because the person is a woman, right? We have just a specific concept or public policy or whatever in Brazil, and just means that women die just because they are women. This has to do with hate, but also with sexual violation, but also to do with sexual violation of children and girls, and so on. So in the first place, it's worth mentioning that femicide has been increasing in Brazil over time. So homicide against women, it has been decreasing, and femicide has been increasing. Might mean that people are getting to know more about femicide, so we know more about that and we make this kind of denounce about that. But the issue is that women are not secure in their homes. So home is the first place for violence against women. There's a specific annual report in Brazil. It's called Anuário Segurança Pública, and it says that men, they die mostly at the public spaces, right? So when a man goes to work, or when, I don't know, they are involved with some personal conflicts, they die. But women die mostly because they are violated or aggressed at home. So 80% of physical violence cases against women are due to their partners. So they die mostly because of their partners and at home. This is also related to economic issues, and we are going to talk just a little bit when we talk about labor employment relations, but it's worth mentioning that when a woman doesn't have her autonomy to work and I don't know, to be the breadwinner of her home, she is the likelihood of violence is higher, right? So economic issues are also related to domestic violence, for instance. There is a specific report which is called A Virus in 2 Hours, and it contextualizes how women are dying in the coronavirus context. At the very beginning of the pandemic, 195 women of 500 died because of things as the lockdown, right? So 2 wars, because we first have a war against the virus, but also a war against domestic violence. So the result of that is that during the coronavirus crisis, 1 woman died every 9 hours due to femicide. The causes are, as I said, there's a long list of causes. So it's related to hate, to false imprisonment, to torture, and sexual violence, amongst other issues. It's worth mentioning again that femicide is underreported. So sometimes it is confused with homicide itself. But as we saw previously, femicide has been increasing as well. There are also other, let's say, social markers of difference, which means that women are affected depending on their gender identity, sexual preference, and race. So talking about gender identity and sexual preference specifically, the LGBTQIA people, they are confined as everybody else. And this means that sometimes at home they might be prejudiced due to their identity and sexual preference. And thus, the confinement is leading to a situation where their minds, their mental health is being affected due to the pandemics as well, because sometimes at home they are not accepted and they don't have the opportunity of going, I don't know, to schools, to the university, and to other places where they feel more accepted. And there's a last issue that is not so common in the European context, but it happens a lot, which is called alienação parental. It's the case that one parent talks bad things about the other parent. And sometimes at the coronavirus context, it is an argument for parents to not take their children to the other parent. And this is also an issue that affects specifically women, but also parents in general and children for sure during the coronavirus crisis. So as you can see here, femicide during the pandemic, it's the average is not so good. As I said, femicide is increasing in Brazil, but there are specific states, the black ones, in this framework, in this picture, where you can see that some specific states, they have a higher average compared to the national average on femicide during the coronavirus crisis. Well, talking a bit about gender, labor, and employment relations, it's worth mentioning that Brazil has a high rate of unemployment before the coronavirus crisis. So unemployment in Brazil specifically is quite high compared to the rest of the continent. So we have been facing a picture of high unemployment, and this got worse depending on the sector. I think the commercial sector is the only one where unemployment rates in Brazil are better. People are getting employed in the specific sector or subsector. But the issue is that we face high unemployment rates at least since 2018. And in the coronavirus context, it has besides being increasing, right? Besides the fact that people are getting more unemployed, we have the issue that affects women specifically. So everybody knows that women have the double shifts, which means that they are supposed to work at home, but also to take care of children. Children are not going more to schools, for instance, so they are supposed to take care of their children and also to work at the home office regime. In the cases that women are actually employed, right? Because there are The cases that they are not, which are, I could say, most cases are of informal work. So I don't know, street vendors, for instance, they are being particularly affected by the pandemic because it's not so easy to sell things at the streets because after all, people are at home. They are not going to the streets and buying things and so on. And this affects specifically and especially specific groups of women, like workers of color or with different migrant status than the national. And finally, it's worth mentioning that women are in the front line of the pandemic. So care work is always related to women work, which means that women are mostly nurses and housewives and other kind of health providers, or they perform more, if we can say that, the care work. If we take a look at the figure on the ILO, we can see that Brazil, especially it has high rates of health and social work worldwide, right? So in Brazil, as I don't know, in the US, for instance, or in Australia, we take care of people, of things, because it is kind of related to this idea that women, they take care of people, right? Like they are moms, they are, I don't know, grandmas, and they are supposed to take care of people and things. And if we take a look at the unemployment rates in the coronavirus context, we can see that women got more unemployed than other populations, let's say. If you take a look at the dark blue average, we can see that between 2017 and 2018, unemployment rates, they were, I don't know, X. In 2018 and 2019, unemployment increased a little, but in 2019 and 2020, unemployment rates are quite high, but this affects especially women, as you can see here, but also the youth and workers of color. So if unemployment rates, they affect everybody, I mean, of course, everybody is being kind of contaminated in a double way during the pandemics due to economic insecurity. Women especially, they are getting more unemployment during the coronavirus context. The country, Brazil, has a specific issue that the gender gap itself is higher than the rest of the world. So in the country, women, they get 25-30%. It has been the time series of gender gap pay in Brazil, but worldwide this is like 16%. So here, even if we are employed, even if we work for a specific company or university or an institution that pays you monthly, which means that you are a formal worker, even in that case, women get a high gender gap compared to men. So first, double shift, and then unemployment rates, and finally, gender gap pay in the country. Well, finally, I'm almost finishing. I hope I have time. There's a specific issue of Indigenous women. The actual government is not quite pro-Indigenous people or Maroons or etc. It's a pro-agribusiness country, which means that public policies, they are not directed to Indigenous women or other populations. They are actually directed to the agribusiness sector, which means that, for instance, in Brazil, we have more laws facilitating the use of agrotoxins. what's the problem with that? The problem with that, besides the fact that we have fires in the Amazon or Pantanal, as everybody saw, we have impacts specifically on indigenous population. The government was supposed to direct a specific budget for the health of indigenous women and people in general, but it didn't do so until the public ministry obliged the government to do so. So before that happened, indigenous people in general, they made their independent sanitary barriers, and in some cases they didn't, and they got more contaminated by the virus. After the public ministry obliged the investment in the health of these people, the government is actually militarizing the actual sanitary barriers, or is going to make new sanitary barriers, but with a military profile, which means that probably people will be I don't know, conflicts will not be held by their leaders or etc., but by the military. It's worth mentioning also that the privatization of original people's land dates back from colonial times. It doesn't mean that we don't live in colonial times, but at the classical colonial times, which means that historically people, they lack natural resources and medicine to survive, which leads to a situation where people are getting sick and getting into poverty. Poverty, as we know, in the Western world. The central issue is that they cannot access their own lands, so they are not able to take medicines from nature or to fish or stuff like that to survive. This issue of many ethnic groups highly contaminated or simply contaminated led to a situation where all indigenous women are dying, and they are responsible in some ethnic groups for oral history and customs, and they educate the youth as well. So with that, also kind of the health of indigenous communities also kind of partially died. And finally, it's worth mentioning the marco temporal, which is going to be voted this month, 28, I think it's the day. And marco temporal is a legal argument that people who were not in a specific territory or land at the Brazilian Constitution in 1988, they don't have the right to be there. That's basically what marco temporal says, and it's going to be voted by the Supreme Court in Brazil this month. So everybody's paying attention on that, and just those people are making these movements of making the Supreme Court maybe more sensitive to the issue. Well, just to finish then, state responses to the coronavirus crisis involves lots of issues, actually involves in a kind of responsible way, and the way that the emergency aid or auxílio emergencial before, now it's smaller, but at the very beginning, that's half of a minimum wage or 100 American dollars. This is not enough for a person to survive or a family to survive, but today it's half of that, which means $50. Institutions responsible for women's security, they were partially closed, although the Femicide increased at the beginning of the coronavirus crisis, which means that some policy offices specialized in women's security, they were partially closed. Some activities in policy offices were not public. Which doesn't mean that, for instance, women of color or women with different immigration status are gonna look for police to denounce domestic violence, for instance, because of their vulnerabilities as women of color or immigrants. And finally, the Ministry of Women is getting less and less budget to its activity, and it's definitely not a pro-choice ministry. It's not a feminist ministry. It doesn't always advocate for women's interests, or at least some women's interests, those that are not religious or those who want a pro-choice public policy and so on. Well, that's all I wanted to say. I'm not sure if I talked too much. If I did, so I'm sorry. And Pavesi, please.
And that was perfect. And I think, you kind of gave a lot of suggestions on my presentation. We could just basically replace in a lot of information you brought Brazil for Europe, and we're going to see that we're going to get the same data or similar situations. So this is going to show how this is a global issue, and obviously with different regional nuances, but overall, we're all in the same situation when it comes to inequality. And this is what I'm going to present to you now when I discuss European side. So let me just share my screen with you, and I hope you can all see it. So, and in the meantime, if you have questions, please feel free to type them in. You can type them in Portuguese as well. We're going to be very happy to take your comments and questions. Okay, so let's look at Europe and how well or how badly Europe is doing when we talk about the shadow pandemic. As we have, and as it was clear from Katusha's presentation, we can see there is a broad perspective that we have to take a very holistic approach to discuss the gender dimension of the impacts of the COVID. And Dr. Galeda mentioned some of the economic perspectives. So we have to pay attention on the economic vulnerability of these women, but also the amount of care they are getting, the type of care they are also getting, how this brings to a surge in the number of domestic violence and femicide worldwide. And actually, when we think about innovation, which is a topic, is a perspective that often comes neglected when we discuss gender issues, but who innovates and for whom? So when we think about the future and when we think about new policies, what kind of society are we building? And obviously, perhaps a very critical one is who is projecting these responses, who is drafting these responses, or in other words, where are the women when it comes to leadership and policy making? So let's take a glance at the European perspective for a while, and just to contextualize you in relation to other regions, we're going to consider European mostly advanced economies, and you can see that there's been an increase in the participation of women, so women in between 15 and 64 years old in the labor market. That stands still below an average in advanced economies, still below 75%, but there has been a very significant increase in the share and in the participation of female participation in the labor force in the advanced economies. Interestingly, when we talk about low income, so very poor countries, over these almost 30 years, we see that the number remains still. So there hasn't been, with all the changes we've been witnessing in society and in economy, including all these other industrial revolutions, there hasn't brought you a change in the share of women taking part in the labor force in low-income countries. We see a slightly shy move and more participation of women in emerging market, and that would include Brazil so far, or still, but it's very, it pops to the eye to realize how marginal and how low the participation of women in emerging countries is in comparison to both advanced and low-income countries. So that's already a subject worth researching. And according to the IMF and the ILO, we're expecting that 81% of the working force in the world is going to be affected, and it's being affected by COVID-19. So COVID-19 has brought a strain in labor force in 81% of the working force. And obviously this is higher, and this burden and this tension increases in some specific sectors. And unfortunately, these sectors are the sectors that have the highest concentration of female labor force. So women are more vulnerable also, because when they participate in formal economy, they are taking part, as you can see here, in more social activities, and that would include education, that would include hospitality, that would include health. And those are the sectors, except from health, but most affected. So this is going to have a double effect on women. And if we want to draw a comparison with the 2008 economic crisis that we had, the sector most affected were sectors in which men were most of the labor force. So this is a difference we can see already a difference between the 2008 economic crisis and the economic impact and strains of the COVID-19 on the labor force. Just like Brazil, Europe also records a very high gender pay gap, which on average is going to be around 16%. And by this graph, you can see that there is no correlation between economic development and GDP per capita and the gender pay gap, or gender equality, when it comes to labor, when it comes to economy. So the country with the lowest, well, just like Bulgaria, but Romania has the lowest GDP per capita in Europe, and has the lowest gender pay gap in Europe. So that shows you how we have to think about gender equality in terms of economic perspective, way beyond just improving and increasing the economic power of a country, or increasing its economic growth. So growth is not a direct cause to address this gender pay gap. We need other types of policies and discuss the actual roots of this gender pay gap. So we can see in Europe, on average, we're going to have 16% of a gender pay gap, and that obviously increases in some sectors and increases when we break women into plural perspective, and we look at the different types of women we're talking about. When we talk about women that fit in what would be called a minority group, or when we think about, for instance, single parents. So just to give you some more information, an example, we have in Europe 15% of families are led by a single parent, and 85% of these families are like the breadwinner. So the single parent in the case is a woman. And women on average, so single mothers in Europe with a child that is under 60 years old earn on average 48% less than a man with a child that has the same age. So this is just to show the discrimination and how this intersectionality has to be brought into perspective when we analyze gender inequality worldwide. So going back to what I was discussing, when we look at the specific sectors, we're going to see that there's an increase, there's more presence of women in these sectors that the ILO considers are going to be hit hardest by the COVID-19 effects on the economy. And again, we have also to consider what Galeda just mentioned, that women normally they participate more in informal economy. They have more weak employment arrangements. Either they work part-time or they work in informal economies. And those are also activities, and those are type of arrangements that we have already been witnessing that are suffering the most with the economic sides effects of COVID-19. But as we have been witnessing and applauding on the news, women are at the front line of COVID, so fighting COVID. And that's the case in Brazil, that's the case as Galeda showed on her world map. We can see that as a general trend, and that's also the case when we discuss Europe. So as you can see, in some countries, women, in some European countries, women are more than 80% of the workforce when we talk about the healthcare activities, and that's is going to remain between 80. So on average, we can say it's nearly 80% of the workforce on healthcare in Europe. But yet, just like as all other areas, there is gender discrimination when we talk about activities in this sector, and 72% of the high positions in these sectors are occupied by men. So men can be just 20% of the workforce in healthcare in Europe, but they take the best positions and all the bonus, holding 72% of the high rank positions in these sectors. But that's not just inequality that brings this women at the frontline perspective as a dimension of COVID. We have also to think that these women, they are suffering a lot of pressure to perform, despite the number of deaths among men be highest than the number of women dying with COVID. We know that those at the front line are at most risk. And then as we have more women at the front line by default, and women are at most risk than men, there is a lot of constraints for them to continue providing for their family, to continue supporting their family. Those women have to find arrangements in terms of care, and depending on the position they occupy in this front line, they might not go back to home for maybe a month, because they also don't want to expose their families to risk. So there's a lack of support thought in terms of providing for these families. And we have all kind of inequalities here as well, including the lack of adequate equipment for women. As we know, despite being 80% of the healthcare sector workers, all the equipments and gears, they're projected for men. So for instance, masks, they fit in a masculine model. So, and they're normally too wide for a female face. So this increases the prospect of these women catching COVID and getting infected simply because they don't have the equipment adequate for their body types. So there are all kinds of dimensions when we discuss front lines that are worth bringing. And obviously the invisible workload that, as we know, it just got worse. And women, just like in Brazil, but in Europe as well, they are the primary responsible for household tasks. In general, they're going to perform 92% of the course. They're going to say they perform 92% of the house chores, including food preparation and shopping, even shopping. And because of the lockdowns and kids at home, and this is an important dimension to bear. So according to UNICEF, 1.5 billion students are not attending school at the moment. And these 1.5 billion students are staying home. So someone needs to take care of them. And normally this workload is thrown on women's shoulder. So, and this also creates other types of constraints. So women that do have to go to work, they don't have where to leave these kids because of the high risk groups being especially grandparents, which is a very common arrangement in Europe. So normally parents, they are going to share part of the childcare with the grandparents, and grandparents are not doing that at the moment because obviously they're in quarantine at home. So these also, women are losing the support they already have, or the pool of support they have, and they're having to take care of kids as well when they don't have to look after the elderlies. So we see an increase in the workload of this invisible workload, unpaid, not just invisible, but unpaid workload that women endure in general. And well, there's why shadow pandemic? Because we have to discuss the sex and gender-based violence and how COVID has inflated, so exacerbated this violence. It's important to mention that all these inequalities we have addressed and pointed out to you, they are not a consequence, and they're not caused by COVID. COVID has just shed light on these inequalities and on this type of violences and problems, and it has maybe exacerbated them. So they probably got worse, but it's not because of COVID that we are facing all these inequalities, and it's not because of COVID that we are facing gender violence. According to the UN, we're going to have globally 243 million women and girls yearly being subjected to sexual or physical violence worldwide. And it's also, experts estimate that there will be a surge in 20% in domestic violence cases during the pandemic. This graph is not very, very clear, this other picture, but as you can assess, and it's very hard to get numbers and exact numbers when we're discussing domestic violence, because often cases are not reported, so they don't fit in statistically. It's statistics, but the UN as well and the World Health Organization have estimated that just in Europe alone, there will be an increase in 20% of the cases of domestic violence. And then the way we see women reacting to this varies according to the country and varies according to time. Why? Because we're going to see in some countries, for instance, Cyprus, for instance, France, an increase in the number of calls to ask for help and to call to police or outreaching shelters and any kind of support to break through that situation, to leave that situation, and there's been a significant increase in the numbers. So, and that happened the COVID. So that's a very interesting perspective, because why? Well, in the beginning, we thought this would be a short-term arrangement. We wouldn't have to stay at home for too long. And when these women found themselves stuck at home with their aggressors, they were more prone to think there would be a way out, and they would call the services and call for help. So between in the first quarter of March, in the UK, for instance, in just one day, they got 700 calls to a call center, 700 calls more than the average daily calls they would get of domestic violence victims. And there's been, but what happened? What happened is that they started realizing there was poor assistance. These women start feeling that they couldn't leave home. And if they leave, where would they go? With COVID and with the pandemic, we saw a lot of NGOs and social workers shutting their services or suspending their services, be it for a lack of resources or for a lack of security and health conditions to perform. So we saw a retraction on the participation and the offer of civil society groups and NGOs assisting these women. And also we saw a lack of performance from states to actually engage and to do something about these women since they are in lockdown. And this sounds like a very paradoxical message, because on the one hand, governments say, stay at home, don't leave, and that's the best thing you can do, or you're forced to because of lockdown rules. But on the other hand, sometimes it's definitely not the safest arrangement for a woman to be on a lockdown with her abuser. So the numbers, they vary a lot. And so just to bring you from another region, but in the United States, in New York, for instance, there's been a drop in 44% on the number of calls to rescue. So it's very complicated to actually get a very clear picture on what's going on in terms of domestic violence when it comes to statistics, when it comes to numbers. But what we know for sure, has been an increase because these women are more exposed to situations in which they can suffer sexual or any kind of other violence or physical or sexual violence at home, being in lockdown with their perpetrators. Different countries have also tried to adopt certain measures for this. So, for instance, in France, the government put 20,000 hotel rooms available to abrogate, to host these women, so to provide shelter for these women that had to leave home in a situation of domestic violence. In Italy, they adopted the opposite approach. So Italy passed a law in which it states that in case of domestic violence, it's not the woman who has to leave, but it's the man who has to leave, which makes absolutely sense, right? Like, you're suffering the violence and you have to leave your home, leave your belongings behind, and find yourself locked down in a hotel room somewhere in a situation of a pandemic. Sometimes women will prefer stay home. And also because if they leave, they might leave behind the kids. So there's no clear legal disposition on what's going to happen to these kids and what's going to happen maybe to their parents when they live with them. So this creates a whole complicated context to think that. Also in the UK, because recognizing the surge in domestic violence, the government in April announced a fund of £80 million to shelters. And this has come in good times, because what we saw in the previous years is a lot of shelters closing because of lack of funding. So there've been cuts in social policies addressing domestic violence in the UK, and that has led to the suspension of some important and crucial services. So what we saw now is the government, recognizing that it has to do something and bringing this £8 million funds, £70 million funds to sponsor the opening of new shelters in this moment of pandemic. And again, in relation to that, is interesting because this data is followed by another data that is very interesting, that shows that the cost of domestic violence for the UK economy, and this is information from the UK government. So they analyzed, and the cost of domestic violence is £66 billion yearly. So, and that is going to include legal costs, and that's going to include police services, that is going to include some kind of financial assistance they might give to the victims. So 86 billion is the economic cost of domestic violence in the UK. And now they're giving 70 million. So it's not a very fair trade-off. But anyway. So also we see a surge in femicides, just like we're witnessing in Brazil. And another British data for you, just because the UK left the EU, in the UK, we saw also an increase in almost 30% of femicide rates during the pandemic, and this is likely to increase. And here you can see that this is a problem in several countries. And what I think is very interesting is the high rate of femicide caused by family members and not necessarily just intimate partners in some European countries. So that's an interesting dimension. Yet, it's very hard to believe it, but 27% of European citizens, and this includes women, think that rape could be justifiable in certain cases. So there is a lot of stigma on sexual violence, and especially on rape. So we can see that we have a very patriarchal and a very sexist cultural and social environment and values. So almost 1/3 of the EU citizens think we could justify rape by some cases, including when the woman went home with someone, or if the woman was drunk, or if the woman is walking alone at night when it happened. And we're going to see similar opinions, I bet, when we discuss Brazil. So what can we do and how to tackle this? The big question in IR and in politics, where are the women? We also have witnessed interesting news and interesting reports on how women leaders were doing better at addressing the pandemic than their female counterparts. So why we don't have more women if women are that good? I know this is not a gender equation, so it's not simply because women are brighter and smarter and more sensitive than men, which is true, but there's a way more problematic question to put this in a black and white perspective as women versus men in leadership style. But it's true that in general, what we see is that countries that have women as leaders are performing better in handling the pandemic. Despite that, women are still have a very marginal role in politics in Europe and in Brazil. And on average, women, they're going to be in terms of 30% of national parliaments in the EU are going to be, the chairs will be held by women. So it's just under 1/3 of members of European parliaments in general. So national parliaments are going to be women, with some differences in some countries. And, let's all praise Scandinavia for having 46%, so they're almost on parity. And then when we look at the executive side, we are going to see 7.2% of heads of states being women, and heads of government 6.2%. And when we talk about ministers, just 20% of ministers are women, and slightly more than that occupy the position of health ministers. So we need more women to discuss these issues. We need more women in power and on leadership position. So what could or should, no, what actually we must do. So what should be done, we must be done. I think the number one recommendation is to adopt comprehensive gender-sensitive policies throughout all the subjects and throughout all areas. And secondly, is not just place women as victims, but to put women as protagonists of policy making. So to support and promote women's active participation in leadership and decision making. We shouldn't be just waiting for men to decide what is best to do to address gender inequality, but we have to be heard, and we have to take part on those decisions and those policy crafting in order for them to be gender balanced. And then obviously more specific recommendations. So especially when we talk about violence, hire more specialized social workers for police station, better train police, better train legal courts. So prepare them to discuss these issues and to judge and to have a fair judgment and to support victims, which is something that we don't often see. Increase educational programs to raise awareness on gender balance based violence, but on gender inequality in general, right? Why do we have this gender inequality taking place? It's not enough having rules that state that women should take part in politics, that women should earn the same as men, when in practice, the application of these rules depend on our social and our cultural values and perspectives of seeing the role that men and women play in society. So unless we educate people to be to have a different view on gender, we're going to perpetuate this gender inequality. Provide financial support. Until then, until we have equality, we still have women being in more vulnerable groups. So sometimes they don't leave a domestic violence situation because that's going to put them in a worse off economic position than they were before. And if they have kids, they're going to think that they should sacrifice themselves for the sake of the family. Also, they tend to leave work because they have to look after the families as well. So that's why women are more participate more in terms of part-time works or informal activities, because that gives them the flexibility that sometimes they are obliged to have in order to balance this unpaid and paid workload that men don't have to do. So increase confidentiality rules, also to report the cases. provide more shelters, that's crucial as well, guarantee childcare for working moms and for mothers in a vulnerable position when it comes to violence, offering parental leave or supporting companies to do that and punishing companies that don't. And I didn't bring this here because we would go way beyond our time if we entered this discussion. But another dimension that is very important to bring when we discuss Europe is the vulnerability of some special groups, including refugees and migrants. So if this all very disturbing scenario affects women, they are considered EU citizens and they are participating sometimes in the economic activity and that enjoy their civil rights. Let's not mention how refugees and migrants and other minorities that are outside the system, they're not included in the system, are being affected by that. If they already have if they already have to go through several obstacles to be part and to integrate in society, now COVID is making it way harder for them. And sometimes the policies we see, the few policies we see addressing gender inequality, they address the ordinary citizen with an EU passport. And they tend to not pay attention to the dimension of this other vast group of women they're fitting, the refugees and other minority groups there. Anyway, that's what I had to say. And we have a few questions. So thanks for staying with us so far. Don't leave us yet because we're entering the most interesting part. And we have a few questions and I would like to pose them. And maybe Katusha and I, we can just both share the answers. So from Claudia Marconi, assuming this dimension of labor and employment relations, women are more likely not to be in paid work or even to be in low paid work or in temporary jobs, as is demonstrated. In this sense, they are more financially vulnerable than men, especially in this pandemic context. How do you see the long-lasting consequences of this process? And do you recognize some policymakers here in Brazil addressing this issue? So how can we think about that? And then we have some on domestic violence. Let me try to group them. We have another one. So in Ireland, so Isabela Camacho. In Ireland, for instance, women earn 3 months of maternity leave and men 3 other months, and then they can share the remaining. So she's sharing her experiences, which is very good. And that's why in Scandinavia, we tend to see more gender equality than in other places. And what kind of best practice we can mitigate. And then we have some questions on domestic violence. I'm going to leave to a second set of questions. So the first one, let's discuss the economic impact on the long-lasting potential impact on women. And Katusha, how do you see this issue from the Brazilian perspective?
Well, thank you for your questions. I was thinking about that when Professor Marconi asked us. I think there's a set of issues that I'm gonna introduce here, but I don't think they finish the debate. It's just some issues that we can bring for our reflection. I think that domestic violence is for sure one of the consequences of women's employment, as they are sometimes dependent on men's wages to maintain their houses. Of course, it's a more complex issue that is also related to effective relations inside the homes and the marriage institution and things like that. But I think that at the economic side, the immediate consequence of unemployment rates of women is the aggravation of domestic violence. And it's worth mentioning that it also affects girls, because of course, if a child sees domestic violence at home, it's going to affect her forever, probably. I think it's also related to food security, and then food security of girls and children. women are more frequently than I would like to say breadwinners, even though if they are in the informal economy or they are underpaid, they are the breadwinners of their homes. So this led to a situation of food security of houses for sure. And there's also this economy of care. There are studies that show that women, they invest more money in the care economy, let's say. So they buy more food, or they buy more clothes for their families and so on. So I think this is going to affect also this economy of care. And there are also consequences at the macroeconomy level. Unemployment rates in general leads to a situation where wages in general, they are lower. They are not so high because the employer has freedom to contract workers in general, and the wages they would like so. And I think that one of the consequences of that is also the informal work side. Since women, once they get unemployed, they're going to try to sell food, or they're going to try, I don't know, to sell products made at home to try to bring some income to their houses. So I think this is one of the consequences. And the other question was Isabella Camacho's question. That's right?
Yes.
Yeah, I think that maternity leave is just one thing in the whole context of women's vulnerability and the maternity itself, right? I think that maternity leave is just the first step, let's say, of a whole life of maternity and relation with children. So, as Professor Pavese said, shelters in Brazil, Casa da Mulher Brasileira, it's a public policy that it's not so good currently. We don't see this kind of provision of a shelter, of an economy for women who are violated at home. And in Brazil, Lei Maria da Penha does not provide this issue of the men should leave their homes. It's not a mandatory issue. And Maria da Penha, the only mandatory issue is that men cannot get close of their victims. That's the only issue at Maria da Penha. And this is a long process that starts at the police station, and then it goes to the legal processes of penal crime, of a very serious crime Maria da Penha provides. But as Carol said, there are also other public policies or policies in general that not necessarily comes from the state that are worth of mention to other populations of women as migrants, refugees, women of color, and etc. Right? So public health care, public education, access to commons. In the case of Indigenous women, they are some of the answers that can be given if we want to achieve all those different kinds of women.
Well, thank you. From the European perspective, let's start with the income inequality. We're seeing already also an increase in unemployment rate, so the economy was not doing so well even before the pandemic. But we saw this gender pay gap getting closer to reducing. We also witnessed an increase in women's participation in the labor market. So those are effects that we saw, we were witnessing before the pandemic. But as we saw also in the case of Brazil, this is bringing women's back to a situation. So the income inequality in Brazil and the participation of women in the labor market is going back to the 90s, right? So we are the pandemic was enough to ruin 30 years of an economic empowerment in Brazil. And we're going to see probably not a such disastrous effect in Europe, because we have better welfare states and more state support. So that's when it's crucial. When you detect these inequalities, that's when you need public policies to be not to be a one-size-fits-all policy, and they need to address the specific needs of some part of the population. But certainly this is going to have a long-lasting effect in all kinds, especially in the activities that are hit the hardest when we talk about labor force in general. And as we know, the first ones to be able to recover are men, and we've seen that in other pandemics. So even when we talk about also because women are going to be left with other damages to repair, right? When we said again, the workload, the family losses, the loss of income in other family members, violence. So there are many other dimensions that is all going to be bring together and make it harder for women to overcome that. In terms of, and going slightly to Rafael's question, but also staying at Claudia's, when we think about policy and political responses to that, the European Union itself has very little room of maneuver to actually operate. So it adopted it has the 2025 gender gap strategy, or gender equality strategy. So it has an overarching program, which is a strategy with some projects to be founded, so we can keep an eye on that. But with many of opportunities, but it's more like a guideline of what states should be discussing and doing. And in terms of effect in policy making, in rule making, law making is very weak, as we know. In this area, the EU doesn't have much competence, so it's more articulating a dialogue between member states. So this is left very much to national states. And then what we saw as well, there's a very interesting global gender tracker report from the UN Women, and they conducted a survey with 206 countries, and they looked at the political responses and policy responses to COVID. And they found in this study more than 2,000 policies that touch upon gender somehow, even very marginally. But what is interesting, that is by far the absolutely vast majority of these policies, they are specifically aimed at addressing domestic violence. And just 8% of them provide some kind of support or focus on the unpaid work. And 10% of these legislations, they are going to cover inequalities in the workforce. So we can see, again, when we talk about women and we discuss inequality, when states do something, they're going to do more and they're going to talk more about domestic violence than address the other factors that correspond to this overall inequality we witness. So, which is not sufficient as well. What else do we have here? So what to be done and how to address, just to complement, we didn't bring kids here, we're talking about women, but obviously this put a big burden on kids, because they're going to we have more kids now on the poverty line, we have kids without schools, and this creates a lot of inequality as well between kids that can afford internet and kids that cannot do that. The living standards they endure are very different depending on the social class and depending on the region we're talking. So this creates more vulnerability. When these women, they have to go back to the workforce, and which is something very common we see in Brazil. So it's interesting when we talk about the share of single parenting in Europe, which is 7 million in the whole EU. And when we look in Brazil, we have 20 million single moms, so single parents, mostly women here. And these women, they work in an informal economy and they have a poor working arrangement, and they have to go back to work, right, when they're not recruited. So they have to earn their income. So what do you do with the kids if you live in a country that doesn't provide any kind of support for that? So in the end, these kids, they end up in a very vulnerable situation. So either mothers lock them down at home and then leave, and then they do that with a 2-3-year-old, because what else can they do? Or they assign this care to a neighbor or to a relative or to someone they don't trust, and they might put these kids at the risk of being abused. So this has also consequences for kids when we discuss that. Maternity leave is a crucial element when we discuss the adaptation of the workforce to be adapted not just for men, but to serve women as well. But this is, as Galida said, this is just one tip of the iceberg. And as we know, in Brazil, 50% of women, they are fired from their jobs once they return, up to 2 years after they return from maternity leave. So we might have this legal right. We might take the 4 or 6 months, depending on where you are in terms of maternity leave. But there's still a big stigma on working moms. And then you cannot perform, the society sees as you cannot perform both well. So you do not, once you become a mother, which is your sole purpose in life, in society, right? That's what women are for. I'm joking, but that's how it's envisaged. So we have this big burden and this big pressure to become a mother, because that's what they see as the role of women in society, the primary role of women in society. But once you do that, you're punished, right? So it's a bit paradoxical to think that motherhood is so praised at the one hand, and on the other hand is like you're gonna pay a very high price for that. And in terms of the EU Agency for Law Enforcement Training, so how the pandemic could fit. So part of the EU gender equality strategy is to address especially domestic violence, but also to increase the share of women in politics, the share of women in the private sector, in leading companies. So it's a very holistic approach to gender equality, but they also bring a lot of emphasis on domestic violence. So we can see that in the EU. We also have the Istanbul Convention that is not a EU document. It's the Council of Europe that is going to include Turkey and other European countries, so in part of Eurasia, if you want to call. And this Istanbul Convention is from 2017. So that addresses specifically domestic violence. So in the normative perspective in regional arrangements, we can see some increase in this discussion and some attempt to create more norms to address this issue. But as we know, and as we know here, having a law is only the first step, but it doesn't guarantee that the issue will be addressed properly and that you're not going to have an increase in that number. So you need actually to have a change in society. So the rule, the law is just the first step, I would assume. And I think the main, so what should be done? Education, that's the core and the sole strategy to have a long-term change. If you educate people to understand men and women differently than we already do, and then what we're doing so far, that's when we can change the way we relate to each other and the place we give women in society. So that's what I had to say. Katusha, would you like to wrap up and then we can let them go?
No, I just want to say that I totally agree with the education side to solve the problem, the deep problem. And I think this should be followed by structural dimensions of our societies, like changing access to education or access to health, and like paying more education instead of paying public debts, for instance. Just wanted to add that. And thank you all for watching us, and thank you all for having patience and the invitation from Professor.
Well, it was a pleasure having you here in this discussion. I hope you enjoyed having us here. And if you have more questions, just feel free to drop a line. I don't know how I can type my email here, but you can just Google us. Then you're going to find us in social media and then get in touch. But this is an issue that affects all of us, including men. And I think it should be at the core of policy making. It shouldn't just be, we have all policies and then this is just one part of the menu. It should be the main priority. And if we address and we start developing all policies from a gender perspective, then we're going to have, a proper solution to the issues, and an intersectional perspective. I think that's my last comment, right? As we phrase it, there's this indigenous population perspective here in Brazil, there's a class dimension, there's a racial dimension, there's a minorities, or there's a citizenship status, especially in Europe when we talk about refugees and migrants. So there's many aspects, and we should not put this in a one-size-fits-all policy approach as well, which is completely wrong. Thank you again, and see you next time.
Há 118 anos, 2 visionários se juntaram para criar a primeira escola de comércio do Brasil. De lá para cá, a FECAP não parou de juntar. Juntamos sonhos, somamos esforços, aproximamos talentos e empresas. Juntamos quem é diferente, unimos fronteiras, colecionamos conquistas. Somamos conhecimento, unimos a tradição e o novo. Juntos, misturados, conectados. O que nos junta vai além do espaço físico da sala de aula. O que nos une é o espírito alvarista de trabalho em equipe, cooperação e inovação. Estar junto é ter alguém com quem contar. Estar junto é ter alguém para nos incentivar. Junte-se a nós. Juntos, iremos cada vez mais longe. Na FECAP, a gente realiza juntos. FECAP. 118 anos juntando tradição e juventude.